Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, ADHD, that is Attention Deficit Hyperactivity Disorder, is one of the most common neurodevelopmental disorders of childhood. Now, it is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, like may act without thinking about what the result will be or be overly active. So, to discuss on the topic, we are being joined today by Dr. Mridusmita Neog, psychologist and a psychotherapist. So, not to waste any more time, I'll straight away move to her and talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, today the topic which we have taken, we will be talking on that elaborately, and we are going to touch upon the topic related to children. Now, when it comes to children, of course, the parents will be really concerned what exactly the matter is, how to take care of their children. Now, let's start up with what is ADHD.
Okay. So, when we say ADHD, Attention Deficit Hyperactive Disorder, it is particularly a developmental disorder.
Okay.
Necessarily, we can see in children inattentiveness, hyperactivity, impulsivity. So, these are some of the signs that we can see in children.
Okay.
Very much clear in childhood. It might extend till adulthood and to the teenage as well. So, attention deficit hyperactivity disorder is a developmental disorder.
Okay, developmental disorder. So, if a person has to know about the basic symptoms of ADHD, so what would be that? And we will also talk about the age group. At what age group does it start?
Particularly the age group, most necessarily it has to be prior 12 years of age.
Prior 12 years.
It will last till 16 years of age.
Okay.
But yes, the symptoms, the signs that has to be there up to 6 months.
Okay.
And I will come to more of signs and symptoms and we will discuss about it.
Okay, okay. So, let's talk about the basic symptoms, and we would also like to tell our viewers that our numbers are flashed on your television screens. So, if you have any queries regarding the topic which we have taken and we are discussing at this hour, so please call up and ask your question. Doctor, coming back to you again, let's quickly know about the basic symptoms about or the signs and symptoms we have to know about ADHD.
See, in children, we can see inattentiveness.
Inattentiveness.
Yeah, they are unable to pay attention to the minute things like doing their assignments on time, or following instructions, or organizing things in their day-to-day life. Then we can say hyperactivity, impulsivity. Hyperactivity, we can say restlessness. They are not be seated in a particular position, they move here and there restlessly. And impulsivity, without thinking anything, they act impulsively. So, these are most common symptoms that we see in children.
Now, these symptoms, does it start at a very early age, or there is a certain age period? We suppose a child is born normal and when he is attaining his age year by year, everything is normal. But when any parents or anyone comes to know or to see about these signs and symptoms, the basic signs and symptoms, so is that the right time to go and see a doctor, or one has to notice about those symptoms? Is it aggravating or not?
Yes, yes, definitely. Once the parents notices this kind of symptoms, the child is unable to do the regular stuff or activities, unable to follow the instruction, or they are restless or impulsive in doing things, they should definitely seek expert advice. Because whenever we are particularly find such kind of issues in a children, and early diagnosis and early treatment helps the child to manage this kind of issues in a later stage.
All right, we'll talk on that more, but we have a caller at this point in time. Let's take the call. Hello. শুনি আছো, আপোনাৰ প্ৰশ্নটো কৰিব।
হয় হয়, মোৰ মানে ফাৰ্ষ্ট বেবিটো 5 years হৈছে, আৰু তাৰ মানে কি হয়, ই পঢ়াটো ইণ্টাৰেষ্ট হেৰি, আৰু ছেকেণ্ড কথা হৈছে তাৰ ডেটটো খুব বেছি। তাৰপিছত খাওঁতেও সি কমচে কম আপোনাৰ 1 ঘণ্টামান লগায়, আৰু সি কেতিয়াবা কেতিয়াবা মানে গম নোপোৱাকে পায়খানা কৰি দিয়ে সি জানি বুজিয়ে কৰি দিয়ে নে কি কৰে এটা আমি বুজি নাপাওঁ কিন্তু সি অলপ দেৰি পিছত নিজে কয় তাৰ পেটটো চাওঁতে যে সি পায়খানা কৰি থৈ দিছে অলপমান সেইটো সি কণ্টিনিউৱাছ কৰি আছে আমি চেঞ্জ কৰিব পৰা নাই কি কাৰণে হৈছে সেইটো বুজি পোৱা নাই আচলতে
যেনেকৈ আপুনি ক'লে যে টয়লেট ট্ৰেইনিংটো দিব লাগিব কি হয় যেতিয়া আমি ল'ৰা ছোৱালীবিলাকক দেখা পাওঁ তেনেকুৱা বিহেভিয়াৰেল ইছ্যুজ কিছুমান থাকে আৰু খুব বেছি জিদ ধৰে তেতিয়া প্ৰপাৰ ট্ৰেইনিংটো দৰকাৰ প্ৰপাৰ ট্ৰেইনিং মানে আমি সাধাৰণতে ল'ৰা ছোৱালীবিলাকক কি কৰোঁ যে যেতিয়া বেয়াকৈ আচৰণ কিছুমান দেখায় তেতিয়া আমি পানিছমেণ্ট দিওঁ কিন্তু আমি প্ৰপাৰ ডিচিপ্লিন যেতিয়া কৰিবলৈ যাওঁ ডিচিপ্লিন কৰাৰ লগে লগে এটা পাৰ্টিকুলাৰ বিহেভিয়াৰ আমি তেওঁলোকক শিকাই আছোঁ সেই পাৰ্টিকুলাৰ ৱেত আমি বিচৰাৰ ধৰণে যেতিয়া তেওঁলোকে সেইটো পাৰ্টিকুলাৰ বিহেভিয়াৰ কৰিব আমি তাৰ কাৰণে ৰিৱাৰ্ডছ দিয়াও দৰকাৰ মানে তাৰ কাৰণে আমি প্ৰেইজ কৰাও দৰকাৰ সেই বস্তুটো ADHD ল'ৰা ছোৱালীৰ লগত খুব বেছি আমি মন দিয়া দৰকাৰ দ্বিতীয়তে আপোনাৰ বাচ্চাটোক প্ৰপাৰ বিহেভিয়াৰেল ট্ৰেইনিং দিয়া দৰকাৰ আৰু খুব বেছি যদি আপুনি এইখিনি দেখি আছে আপোনাৰ ওচৰত যদি কোনোবা মেণ্টেল হেল্থ এক্সপাৰ্ট আছে বা কোনোবা ফিজিচিয়ানো যদি আছে আপুনি কনচাল্ট কৰক ডেফিনেটলি তেওঁলোকে আপোনাক প্ৰপাৰ গাইডেন্স দিব
All right. Thank you so much for calling. Now, doctor, do you think this is also a problem related to ADHD? Just the caller.
Yes, can be.
Okay,
it can be.
Okay.
But there are some other criteria as well. We have to see those criteria before diagnosing the child with ADHD.
Okay. Now, we were talking about the age group. Now, which age group do you see a maximum number of ADHD
It might start as early as 4 years.
4 years.
Yeah.
Okay.
And it might last to 12 years of age till 16 as well. But in the latter stage, we might see some other issues along with ADHD.
Okay.
Might be in the latter stage, the issues like I said, the restlessness, the hyperactivity, or the inattentiveness, it might slow down and some other issues might pop up.
So it may vary from person to person
Yeah.
as well, and
Yeah.
the changes might be seen in children but in a different age category
Yes,
as well.
yes.
Now, if a person or if the parents come to know or might see some these signs and symptoms which is also little bit related to ADHD, so is that the right time to go see a doctor?
Yeah. Consulting at the earliest is important because only when through proper medication, through behavioral training, the child might be cured.
Okay.
And proper management is necessary.
Proper management. Now, if we want to know about the diagnosis process, now how a child is diagnosed with ADHD, now if the child is being taken to a doctor, so what is the first thing, what is the diagnosis process, and we would like to know about that.
So there are several diagnostic criteria based on which we diagnose the child with ADHD, and while consulting a clinician or a physician, they will definitely talk to the parents as well as they will like to talk to the school teacher as well, because the signs and symptoms must be prevalent in at least 2 settings.
2 settings.
Not necessarily in home. The parents might come to us saying my child is not paying attention and not following our instruction, but the child is following the instructions in school.
Okay.
In that case, we cannot say that child is falling under ADHD.
Okay.
So it has to be
so those differentiation has to be done, and also things has to be taken out from the school authorities as well.
Yes. So the signs and symptoms has to be there in 2 settings at least.
Okay.
Only
2
then,
settings.
Yeah, 2 settings. So
now we should not forget that we are talking about the children, and it's very sensitive matters. Like we have to first talk to the parents, and of course, when you're dealing with the children, it becomes a sensitive and it becomes a very hard for them to make them understand what exactly the matter is, because we should not tell them that they are going through any kind of problem, so that might tend them to think more about it.
Yeah. Because parents also become so restless and they are so stressed how to deal with certain kind of situations with their child. They are also clueless how to go ahead with their child, because they might be thinking that my colleagues or my friends' children are not behaving in this way. Why my child is behaving?
Acceptance part is very important.
That's why proper parenting training is also necessary. we teach parents also certain parenting skills. So, and it is also necessary for parents to handle their stress also. So stress management techniques are also taught to the parents to handle their stress.
So what is the first process? Like a psychologist is always there to help parents as well out, and because they have to have their notion, because a lot of confusions might create in their mind, a lot of questions might arise at that point in time because it's related to their children. Now at that point in time, how do you deal the entire case?
In a clinic, particularly a mental health clinic, as I have said that the psychologist and psychiatrist work hand in hand. So the first and foremost thing is medication, depending on the severity of the case, to manage the issue. Along with medication, the behavior training has to be there. So when it comes to the behavior training, so several steps are there. It also includes the family counseling is there. It also includes how the child has to be dealt in school. So the teacher has to be make aware about how to be dealt with. So certain steps are there.
Certain steps which are linked with each other. That is very important. Doctor will come on that discussion part. We'll have to take a break at this point in time. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic which we have taken today, that is ADHD. Now, doctor, we had an idea about the diagnosis part and also about the basic signs and symptoms and how things are related, how there is a link that has to be taken care of, and how one has to understand that this is a problem which has to be ruled out at the earliest. Then only the treatment part can start. Now, if we talk about does ADHD look the same in all children and teens? Now we'll come on that, but we have a caller at this point in time. Let's take the call. Hello.
Hello, more Laura for boy for the তাৰ মানে প্ৰবলেমটো কি হৈছে ই ৰাতিপুৱা যেতিয়া স্কুল যাব হয় সি উঠিব নোখোজে আজি এবছৰ ডেৰ বছৰ ধৰি এই প্ৰবলেমটো ফেচ কৰি আছো ৰাতি সোনকালে খুৱাই দিলো এৰাউণ্ড 11:30 খুৱাই দিলো তাৰ প্ৰবলেমটো আৰু স্কুলত গৈ কি ঠিকে থাকে মানে এই যে পুৱা উঠাৰ যেটো প্ৰসেস মানে সেইখিনি সময়ত কি দাঁত ব্ৰাছ নকৰাকে গুচি যাব খোজে তেনেকুৱা ধৰণৰ প্ৰবলেমবিলাক খুব বেছিকে ফেচ কৰি আছো এতিয়া তাৰ কাৰণে কেনেকুৱা ধৰণৰ মানে ষ্টেপ ল'ব লাগিব এই প্ৰবলেমটোৰ পৰা হাত সাৰিব পাৰি
এটা ৰুটিন বনোৱাটো খুবেই দৰকাৰ বাচ্চাটোৰ কাৰণে আপোনাৰ যেটো প্ৰবলেম আপুনি কৈছে যে এটা প্ৰপাৰ ট্ৰেইনিং দিয়া দৰকাৰ যে এটা পাৰ্টিকুলাৰ টাইমত এটা পাৰ্টিকুলাৰ বিহেভিয়াৰ হিচাপে এক্ট কৰিব লাগিব গতিকে এটা প্ৰপাৰ ৰুটিন যেটো এভৰিডে ফলো কৰাটো দৰকাৰ তেনেকুৱা এটা যদি কৰে এটা প্ৰণালী বনাই লয় মই ভাবো হেতু আপোনাৰ কাৰণে হেল্পফুল হ'ব ঠিক আছে
All right, doctor, why is this sudden change seen? Because when we are talking about children's, a lot of changes come in them because if they are following the same routine, they might get bored also. So that might be changed or that might be converted in some interesting kind of things as well. As you earlier mentioned that if the children has done something good, that children can be rewarded. So that is a good gesture to them and they might also feel excited to do things more, isn't it?
So that's why to break the monotony, we imply the reward system. Like we give them punishment while doing something wrong, we have to praise them also whenever they are doing something correct. Or the acceptable behavior according to us that they are doing. So that's why this kind of reward system is necessary in their life in terms of training the child.
Now both things has to be done simultaneously. It should not be more or it should not be less as well. If you reward them more, they might think that okay fine, so things are very easy.
That there when the role of the parent comes in. So parent has to decide it more creatively, where they should actually apply. The reward system and where they should not apply the reward system. So they have to see
They have
in
to
terms of
differentiate about good things and bad things as well.
in terms of training the child.
Training the child. Now, we were talking about ADHD. Does it look same in like all children and teens? What do you have to say, doctor?
It more or less same in
More or less
teens.
same.
Yeah, more or less same, but it varies also. Because in childhood, whenever a child is prior 12 years of age, we can see the inattentiveness, the hyperactivity or the impulsivity in them. But as the child grows to the teenage and to the adulthood, the inattentiveness might not be there, and such teens or adults might engage into risk-taking behavior. The impulsivity, there the impulsivity plays a major role as the child grows. That's why the behavior training has to be there.
Okay, any example, doctor, like what you're talking about?
For example, I can say there was this kid in our clinic. He came to us at around 15 years of age, and the parents complained us that he do not listen to us, and all the time he is engaged in mobile and looking all sort of unwanted stuff.
Okay.
So now after multiple sessions, we dig in to the fact that the child was diagnosed with ADHD at the earlier stage.
At the earlier stage.
Yeah, but because the parents was not so aware, or the proper psychoeducation was not there, proper behavior training doesn't play a much role at that point of time. Because of that, the signs and symptoms
was not known to the parents.
That's why it became worse.
They were trying to ignore because they didn't know about that exactly what is happening to their child.
In most of the parents, they feel that okay, they want instant result.
Instant result.
Because what is happening with my kid? Why multiple sessions we are doing and we are not getting any result? But they need to understand that it is a slow process. The child will take time on its own to develop the behavioral pattern that we are trying to apply. But because the parents are not so aware about this particular area, so they want quick results, and because of the discontinuation of the therapies or the medications, the condition worse.
Okay. So what do you think, doctor? Does a lack of awareness regarding the topic, a lack of awareness regarding the subject is one of the matter that parents could not make out that what exactly is the matter with their children if they are facing any problem? So how hospitals or how doctor teams help in these kind of awareness? Of course, we have seen a lot of like NGOs coming up and doing a lot of awareness campaigns as well. So on this note, what would you like to say?
Nowadays, lots of workshops and trainings are done online also. If parents want to attend those workshops and training, they can.
There is a lot of hesitancy also among parents that they don't come open up about these
they don't want to say actually. And we have seen that in their native town, they don't want to consult to a psychologist or to a mental health expert. They will rather travel to some other district or to some other state just to treat the child because of this stigma. Why my child is not behaving in this particular way? So these kind of things are there still, but the parents need to be keep in their mind that the early step they are taking in treating their child will be beneficial for them as well as to the child.
Also. Now, doctor, is this a genetic problem, or why this problem arises in children? What is the matter all about?
Researches are going on. We cannot say that it is based on only one factor, like several other psychological disorders are based on several factors. So, ADHD can be caused due to several multiple factors, whereas researches are still going on.
Is there anything related to any incident with the children or something related to that, or just this is nothing to do with it?
It can be some childhood trauma or some we can say gene can also play a role. All these are interlinked. We cannot say that there is a specific factor that is related for ADHD, that ADHD can be caused because of only this factor. That is not the
Or
case.
a lot of attention or a less attention to the children.
Yeah,
This
because
can also
nowadays
be.
we can see that parents are mostly they are working, and so they try to give proper care and attention, but sometimes they are also helpless. So that can also be one of the cause. Whereas we cannot say that only this is okay. This is the only main cause.
We have seen a lot of children has nowadays become too much of independency can be
Yes.
seen as since a very tender age among them because of the working parents as well. So is that one of the criteria, or is that one of the reasons that they go through such kind of problems, which nowadays is being seen?
Yes, and
in
there
maximum
is
children?
lots of emotional vacuum that is developed among the children. They don't feel so connected with their parents. They are unable to express their feelings, their desires to their parents. Like in the previous age, we might be doing. We might be so connected with our parents, but these days, children are not so connected with their parents. Rather, they are so much busy with the gadgets.
Right.
I would say screen time has increased a lot for them.
Parents
So,
have become helpless
yeah.
sometimes to give a lot of time on screen time
Yes.
to their children as well. So how, like, is there a way, like, we won't say 100%, but is there a way to cut down or to erase that vacuum among the children? Like, if there is a talk therapy or something kind of...
See, as we are talking about children, children usually imitate us.
right.
So we have to check on our behavior, how we are portraying in front of them.
Okay.
If all the time, I understand we all are working, so we might be busy with our laptops, with our gadgets. So
Right.
if all the time we are portraying this kind of behavior in front of them, and then I go back home and say to my kid that do not
Take the
take
phone
the
or
phone or the laptop,
Spends more time
then
on
they
phone.
will not follow. So I have to make my life balance in order
Balance
to
those times
in
with-
order to train my kid. I have to take out that time to spend with the kid as well. So that is most essential.
Okay. Now, Doctor, we are really short of time. So how can one help their children at home itself, and then the clinical part comes?
Yes.
But everything starts at home.
Yes.
Diagnosis can be started at home as well. Then, if necessary, of course, doctors are there
Yeah.
to help them out.
So particularly with ADHD, I can say that as they are so high on energy, they are so restless and inattentive in doing stuff. So first and foremost thing, a proper routine balancing their entire day. The routine should include all the tasks they might be doing in the entire day. Proper exercise is necessary. Might be any playful activity to channelize the excessive energy that they might be having.
Okay.
And proper sleep hygiene is necessary. To maintain a healthy sleep is necessary, and yes, to have a balanced diet is necessary for them.
Balanced diet is very important
For the kids.
for the kids as well, and for everybody
For
as well.
everyone,
For physical
yes.
activity is also very important.
Yes.
Well, Doctor, what would you like to suggest who are watching our show at this point in time? Like, how can they manage their time for their children as well? And if they find any kind of signs and symptoms, is that the right time to immediately go and see a doctor, or they can start, or they can just change their routine or change their lifestyle, what they were leading over these days?
Like I am saying, the children should have a routine. We as an adult should also have a proper routine that would balance our work life as well as our family life. Because back in home, we need to spend time with our kids, with our family. It cannot be a mechanical thing. We need to spend time with our kids so that they find it emotional, they find the emotional connection with us. That's why balancing our life is also important. And like I said, the children imitate us. So please check on the behavior that you are portraying in front of your kid. Only then we can go ahead with dealing with our children's behavior. So that's all. That is the message to my viewers. And nowadays, lots of physician or mental health expert are available online also. If you don't feel like visiting one in clinic, you can definitely Google them up. You can connect to them online. Thank you.
All right. So this message is also given not only to the parents as well, and also to the institute or the schools where the children study and spend their hours and hours there as well.
Yes.
Because when you start the treatment or diagnose the children with some kind of problem, we are talking about ADHD,
Yeah.
but there are other
Yes.
problems related with children as well. So school and institutes also play a very important role.
Yes, that's why individualized educational plan has evolved now
Okay.
to pay one-on-one attention to the kids to handle all these kind of issues the child is facing in the school setup as well.
All right, all right. Thank you so much, Doctor,
Thank you.
for sharing those wonderful messages at this point in time. And I'm sure viewers who have watched our show must be benefited with the conversation we had this hour. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.